One of the most difficult things to quit is smoking. And if you or anyone you know is having difficulty with quitting smoking and quitting that habit, then please consider acupuncture as a means to really effectively kick the habit and treat the root of the issue. Hi everyone, my name is Vanessa Ho, a licensed acupuncturist at Healing with Zen in Pasadena, California. Today I'm going to be talking about a case study mainly focusing on a patient who was seeking help to stop her smoking habit. And if you're interested in this case study and want to learn more about some other case studies that we have at Healing with Zen, please go ahead and visit our site www.healingwithzen.com. So today we're going to be talking about a 36-year-old woman who came in to treat a few things, smoking cessation being one of the main ones, as well as treating a locked or trigger finger in her right little finger, and occasional low back tension and pain, very much coinciding with hormonal imbalances. So the patient initially came in on July 19, 2019, which is when we began the treatment process. By July 22nd, 2019, which is her second appointment, her trigger finger was still feeling a little tense and is still locked on occasion, especially when she exacerbated it in a certain position. But we still kept working on it. And she also said that she immediately felt very well rested after the last treatment, which was her first treatment. By her third treatment, she also felt an improvement in her right little finger, trigger finger, because it didn't lock as much and it didn't feel as tight as before she began treatment. She hadn't had any headaches since last treatment. A lot of times she would get these migraine headaches, more so right-sided, around the time when she would have any changes in hormones or right before her period began. She also noticed that she started to crave smoking less than before. Now, she still smoked about 2 times a day, and so she would smoke 2 cigarettes a day, but she wasn't craving it as much. She just remembered that during certain parts of her day, she would usually be smoking, and then that's when she would pull out a cigarette and smoke. So by the patient's fourth treatment, she said that the cravings for smoking were really decreased, even though she would still smoke twice a day. It was more so on occasion when she remembered that there was usually a certain time in her schedule when she would smoke. Her trigger finger also began locking again, but there was absolutely no pain or tension. So by her fifth treatment, the patient, she did not have any headaches before that period, and so that was a big improvement because she usually did have one-sided migraines before her period began. She also didn't crave smoking at all anymore, but would still smoke about 2 times a day just out of habit during certain times of the day. By her sixth treatment, the patient noticed a big improvement with her trigger finger and stated that it wasn't so sensitive anymore. And she was still averaging 2 cigarettes per day on her sixth treatment. So by her seventh treatment, the patient felt that she had much less of a need to throughout the day. She used to describe her need to smoke as something that was triggered by the fact that there was a certain time when she would usually smoke in her schedule. But during her seventh treatment, it wasn't based on schedule anymore, and it wasn't based on craving anymore, which was a really great improvement. On her eighth treatment, which is the latest treatment that we had her come in for, she said that her smoking had gone down to either 0 or 1 to 2 cigarettes per day, and this is really dependent on if she saw someone else smoke, whether that be on on television or in a movie, or if she was walking somewhere and she saw someone else smoke in person. That was the only time that she ever felt like she would pull out a cigarette and smoke it. And even now, if she didn't have those triggers, she wouldn't even smoke throughout the day. So that was a huge improvement. She no longer had any cravings to smoke at all at this point. She did notice one small right temporal migraine a week before her period began, and this was alleviated very quickly as she did take an Excedrin, but we are still working on minimizing her premenstrual syndrome symptoms. Her right trigger finger is no longer tight or sensitive, and it only locks on occasion again when she does exacerbate it, so that is also very much improved. So far, we are only seeing her about 1 to 2 times per week, and we're still making progress in terms of all of her symptoms that she came in with. Our biggest improvement, in my opinion, is definitely stopping her smoking cravings, and that's definitely a topic that is widely covered in a lot of research regarding acupuncture and is shown to be very, very effective. For today's case, it's specifically for stopping smoking, but actually ear acupuncture coupled with body acupuncture is shown to be very effective at any kind of addiction. And that could be anything, not just smoking. So if you or anyone you know is really trying to stop any bad habits, really stop that addiction from coming back, then please consider acupuncture as well as Chinese herbs. In the beginning of any acupuncture treatment process, it's very important to stay consistent and come in frequently so that we can really catch all of the symptoms before they come back in between treatments. She's also coming in 1 to 2 times a week because she's been doing our facial acupuncture protocol, which we will be covering in a separate video for you guys, as this is a really perfect example of how facial acupuncture can be incorporated to someone whose protocol is mainly to help with hormonal imbalance as well as smoking cessation, both of which can really take a toll on the skin. So once again, my name is Vanessa Ho, a licensed acupuncturist here at Healing with Zen in Pasadena, California. And if you are interested in more case studies, or if you'd like to book a consultation and treatment, please go ahead and visit us online at www.healingwithzen.com. If you want to call in for a consultation or book a treatment, then go ahead and call us at 626-377-9596. Thanks for joining me today. I really hope that this was informational and helpful for you guys, and I look forward to seeing you soon in our next video.